So let's talk about stem cell therapy. Stem cell therapy, if I would describe it, would be one of our most important tools to get people back on track in their health and to get regeneration started and to get healing started. So as you may or may not know, stem cells are within our bodies. We're all born with a certain number of stem cells, and throughout life, when we have certain damage or death of different cells, stem cells can be activated because they're part of our reserves, and we have a specific number throughout our lifetime. But if there is enough, I would say, cellular degenerative assault on our body, we tend to deplete the stem cells. And as we get older, the stem cells' effectiveness and number decline. So replacing those stem cells by administering a therapy is a very powerful, very effective tool to get people better. I would say, so who is a candidate? Anybody that has noticed a diminished capacity to recover from different conditions. Sometimes we even see it as years go by, traveling, not having jet lag, having different changes in our schedule. Even bad sleep can be detrimental, and they feel that they don't recover the way they used to recover 20, 30 years back. So when we administer stem cells, we're putting back those reserves. So when we talk about aging, one of the main hallmarks of aging, and aging comes with a lot of different conditions that start to get worse. So you're more likely to get sick if you're older than if you're younger. And that's in part because of the reserves of stem cells. So when we replace the stem cell reserves, we're actually improving and promoting more repair within your body's different organs. So stem cell therapy is one of our most important. And one important thing is that we have access to the best of the best, that the laboratory has a very high quality control in regards to the quality, quantity, and compatibility of the stem cells for our patients. So we have a very, very highly advanced technological laboratory that prepares the stem cells from cord blood. A lot of centers use Autologous. We initiated with Autologous, which means that you use your own stem cells, but we would have to extract stem cells. We would have to multiply the stem cells, but the results weren't always as great as we expected them to be. And one of the reasons is, if I'm a 50-year-old person, I've got 50-year-old stem cells. Even though their stem cells and have the capacity, they don't have the same regenerative power as a cord blood stem cell, which is basically having like an older model versus a brand new model. So we've noticed that the results and the regenerative capacity of cord blood stem cells is way more effective than autologous stem cells. And also in regards to expense and time commitment, it is much more practical for us to be using cord blood. So that's why we use stem cells. Who do we use it on? I mentioned one which is people that are older, that want to regain or recuperate that regenerative capacity on their day-to-day, but also people with certain illness that require repair of certain organs, as well as, and it can go anywhere from immunological, let's say deficiencies or compromise, to even tumors, cancer treatments. So sometimes we use stem cells for cancer because the cancer has overwhelmed the system, has created extensive damage, and a lot of the times the deterioration of their condition is not due to the tumor invading them, but rather all the damage that was left from that. So we treat a wide array of different conditions with stem cells, and that's why it's one of the core treatment options that we use at the Biogenik Center.